I'm Abraham Chaiton. I'm a rheumatologist at the Humber Hospital, and I've actually been here since the opening of the original Finch site. In that capacity in around 1971, I was a family physician and an emergency room doctor. I then returned as a consultant around 1979. I'm one of 4 rheumatologists that are now on staff at Humber River Hospital. My colleagues, Dr. Handelsman, Dr. Kreidstein, and Dr. Berman, who recently joined our department. My role is acting as a consultant in rheumatology for the community physicians who are affiliated with the hospital. I also am on call for rheumatological problems at the hospital, so I'm often called to the wards or to the emergency room to deal with issues that require my attention. Well, I think the whole field of rheumatic diseases is a very satisfying field to be in, because the patients are usually in a lot of pain or have developed a lot of disability. My role is to help with the diagnosis and a treatment program, and I find generally I can help a lot of patients, and they're very appreciative of the responses to my intervention or my advice. Since the pandemic started, we've had to modify our in-office assessments. We're trying our best to do as many virtual assessments as possible, usually for patients that are stable and require simple monitoring. Often that can be accomplished with a video interaction where I can see them, speak to them, and review their lab work and so forth. There are still ongoing in-office assessments, and those are being done as carefully as possible with masking and distancing and hand washing, those kinds of procedures. So the e-book is a product that came out of the Canadian Rheumatology Ultrasound Society. These are a group of physicians, including myself, that got together about 12 years ago to form this non-profit organization. Our mandate is to teach ultrasound to rheumatologists and other physicians who have an interest in neuromuscular diseases, and also to promote education and research. This particular project was developed through an unconditional grant from Novartis. They were able to help fund the work required to produce this electronic book. The book is actually a free resource that is open to not only Humber River staff, but essentially everyone on the internet. It is a very detailed booklet outlining the various procedures that are required to use and apply ultrasound for rheumatology patients. There are now 6 volumes. Many of them have been authored by world-renowned experts. The 6th volume happens to be on procedures, and it was co-authored by myself and Dr. Stein from Montreal, along with Dr. Roth and Sabelis from Ottawa. And we're all practicing rheumatologists, and we all do procedures of a rheumatic nature, whether it's aspirations or injections at various sites. And this particular manual is actually a very detailed, I think well demonstrated manual explaining how these procedures can be safely performed and successfully performed. That's just in general. My interest in the last 12 years has been to incorporate point-of-care ultrasound in the evaluation of rheumatology patients. I do that in my office, both for my own patients and also for other rheumatologists who require that expert information to help diagnose and treat their patients. My goal is to try to teach more and more rheumatology trainees and other physicians in practice already how to successfully employ this modality, which I think is at the cutting edge and really a very useful modality in helping our patients.